Good day, ma. How are you doing today?
My daughter, good day. I'm fine. Oh.
My name is Nwoke Chinyonyele Cynthia. I'm collecting data for the health status of old people in my area. I'll be so glad to ask you some questions. Try your best to give me accurate data.
Okay, my daughter, thank you for this great opportunity. I'll try my possible best.
Okay. Can you describe your current health status?
I've been living with high blood pressure for several years now. I've been on medication by the help of my children. So, apart from the BP, sicknesses that come with old age, like waist pain and body pain. There was one time I suffered for rheumatism, but I'm okay now. It's just the waist pain and the BP that I've been handling.
How often do you visit a healthcare provider?
Okay, I try to go for checkups at least once every month, but sometimes I wait longer if I am feeling okay. Already advised me that I should keep up with my doctor's appointments. That I should not wait when I'm feeling sick before I go to the hospital. So for now, I've been going for checkup according to the doctor's appointment I was given to.
Wow, that's beautiful. What barriers do you face in accessing healthcare services?
One major challenge is the cost of treatment and medication. The hospital bills can sometimes be expensive, and the problem is that their prices vary. It's not what you met the last time you went to get your insulin and other things that you will see the next time you go. So, and then again, sometimes seeing the doctor can be very difficult because he's attending to so many patients and transportation inclusive, because we tend to go to a general hospital that is cheaper, and the general hospital is not a milestone from my area, so I take transportation. So these are the challenge, especially.
Kai, this is really touching. Sorry about that. So, how do cultural belief about aging affect your experience as an elderly woman?
Okay, my daughter, in our culture, some people believe that high blood pressure is just a normal part of aging, so they don't just take it seriously. And some who ought to actually try giving it any treatment resort to using local medicine. Some even go as far as thinking it's a spiritual attack, and sometimes this can be very difficult when they hear that the same sickness they have is what is affecting you and you're going to hospital. The stigma that sometimes come with it is something that is very, very unbearable. But I thank God that apart from our age, my children has done their best to educate me.
Are there specific traditions or practices that impact your health and well-being?
Like I said before, some people prefer using herbal medicine instead of prescribed drugs. Um, I also have been advised to avoid certain. I've been advised to avoid certain food like salt, red meat. Some of it did not come from the doctor. Some of it came from um people around me who are advising me based on their experience with local herbs and medicine.
How do economic factors influence your ability to seek healthcare? What support system do you rely on for financial assistance?
My daughter, like I told you before, my children are the ones sponsoring my medical bills. If by chance inflation happens in the country or there is a low circulation of cash, they are not able to pay workers by any means, it's going to affect me because it means that I won't have what I will use in going to the hospital. And then again, it's going to affect the hospital because if there is increase in the insulin I'm taking, I have to demand more from my children. And if they don't have, it means that I have to skip my health checkup for that month. So, however the economy goes, it affects the way I go for my medications and checkups and treatments. And for the support system, I am waiting for my pension to be paid. But in absence of the pension, I've been spending from my gratuity. But I believe so much before my gratuity runs out, they are going to